Hello, welcome to ERMP and beyond. Today we will discuss another topic related to HIV. When should a patient with HIV start ART? Before starting the case, please subscribe, like and write me your feedback in the comment section. Let's jump to our case without further delay. A 42-year-old male presented to OPD with a complaint of productive cough associated with significant weight loss of 1 month duration. All the laboratory tests were unremarkable, except positive serology test for retroviral infection. What is the next best management plan for his retroviral infection? A. Initiate HART after determining CD4 count. B. Start HART immediately after counseling. C. Send for viral load and start HART. D. Check for eligibility criteria before initiating HART. Let's first talk about how to prepare individuals living with HIV for antiretroviral therapy. Imagine standing at the threshold of a new dawn, where the initiation of ART marks the beginning of a renewed hope for health and well-being. It's essential to gauge a client's willingness and readiness to embark on this transformative journey. Engaging in a comprehensive dialogue about the ARV regimen is not just a formality, it's a cornerstone of care. We discuss the dosage, the anticipated benefits, and yes, the potential adverse effects because knowledge empowers. It's about reaching a consensus on the follow-up and monitoring visits that form the backbone of effective treatment. When it comes to our younger warriors, children living with HIV, the conversation takes a tender turn. It's a dialogue that embraces not just the child, but also the parent or legal guardian, enveloping them in a circle of trust and transparency about their HIV status. The initiation of ART in children isn't a decision made in isolation. It considers their nutritional status, any coexisting conditions, and other medications that might interact dangerously close to contraindications or necessitate dose adjustments. After a thorough discussion, we swiftly assess readiness and offer rapid ART initiation. But what does readiness look like? It's a patient's understanding of the profound benefits of ART, the commitment to lifelong adherence, and the recognition of the importance of keeping to appointment schedules. It's an awareness of the possible side effects of ARV, coupled with the understanding that these are hurdles we can overcome together. And it's an appreciation of the power of disclosure and the strength drawn from family support. When the patient hesitates to initiate ART, it's our responsibility to engage with them, to understand their concerns, and to provide comprehensive support. We must identify and address the barriers that prevent them from starting ART, whether they are psychological, social, or based on misinformation. Let's talk about the undeniable benefits of ART. Not only does it significantly improve the health of the person living with HIV, but it also reduces the risk of transmitting the virus to others. It's a win-win situation, and it's crucial that we communicate this effectively to our clients and their caregivers. Delaying the initiation of ART can have serious consequences. It's not a decision to be taken lightly. Therefore, we encourage open discussions and disclosure to partners and family members, fostering an environment of support and understanding. Community engagement is another cornerstone of this preparation. By involving peers and community support groups, we create a network of encouragement and shared experiences, which can be incredibly empowering for someone about to embark on ART. For those who initially decline to start treatment, we must not give up. They require our continued counseling and support, with weekly check-ins to reassess their readiness and address any new concerns that may have arisen. Now, Let's address the elephant in the room: mental health, substance use, and psychosocial issues. These are significant barriers to initiating ART, and they require our immediate attention. Providing appropriate support and utilizing a variety of patient information materials can make a world of difference in someone's readiness to start therapy. It's also vital for individuals starting treatment and their caregivers to understand that the first ART regimen is their best shot at effective virological suppression and immune recovery. Adherence to the medication schedule is non-negotiable for successful ART. We must also reassure them that while some adverse effects may occur, they are often temporary and manageable. If necessary, adjustments to the regimen can be made to ensure comfort and efficacy. Lastly, it's imperative to have open conversations about any other medications being taken, including herbal remedies and nutritional supplements. This transparency is key to avoiding potential interactions and ensuring the best possible outcomes. Imagine the moment a person is diagnosed with HIV. It's not just a life-changing event, it's the pivotal moment when ART should begin. Why? Because every individual living with HIV is eligible for ART, and the sooner it starts, the better the outcomes. You see, initiating ART at the time of HIV diagnosis isn't just ideal, it's imperative. It's about understanding the gravity of HIV and the lifelong commitment to treatment adherence. It's about ensuring that every barrier to adherence is not just identified, but thoroughly addressed. And when we talk about rapid ART initiation, we're referring to starting treatment within 7 days of diagnosis, provided there are no contraindications. Now, you might wonder, why the rush? Well, rapid ART initiation, which can even be on the same day as the diagnosis, has been shown to increase the number of people starting treatment. It's not just about numbers, it's about saving lives, reducing mortality, and curbing the transmission of HIV from mothers to children and to HIV-negative partners. But let's pause for a moment and consider those who might not be ready on day one. For them, we must offer support, information, and reassurance, because readiness is key to successful treatment. However, there are exceptions, such as in cases of TB meningitis, cryptococcal meningitis, or CMV retinitis, where immediate ART initiation might be delayed. This approach, my friends, is not just a recommendation, it's a beacon of hope. It applies to all people living with HIV, across all age groups, and it's particularly vital for those with very low CD4 cell counts, who face an increased risk of death. Let's back to our case. In the case presented, a 42-year-old male with a productive cough and significant weight loss, alongside a positive serology test for retroviral infection. The clinical picture is suggestive of HIV infection. The management of HIV infection has evolved significantly over the years, and the current guidelines recommend initiating antiretroviral therapy as soon as possible after diagnosis to reduce morbidity and mortality, and to prevent transmission. Option A suggests initiating HAART after determining the CD4 count. Historically, CD4 count was used as a marker to guide the initiation of HAART, with treatment starting when the CD4 count fell below a certain threshold. However, modern guidelines advocate for the initiation of ART regardless of CD4 count, because early treatment has been shown to improve outcomes and reduce the risk of HIV transmission. Option C advises sending for viral load testing and then starting HAART. While viral load testing is an important aspect of monitoring HIV treatment, it is not typically used to delay the initiation of therapy. The viral load gives prognostic information and helps to monitor the effectiveness of ART once treatment has begun. Option D states to check for eligibility criteria before initiating HART. Current guidelines recommend that all individuals with HIV should start ART, and there are no specific eligibility criteria other than confirming the diagnosis of HIV. Therefore, checking for eligibility is not a standard step in the initiation of HART. In conclusion, the most appropriate next step in the management plan for this patient's retroviral infection would be to start HART immediately after counseling, as per option B. This approach is supported by evidence and guidelines that prioritize rapid initiation of therapy to improve health outcomes and prevent the transmission of HIV. It is important to note that while CD4 count and viral load are valuable for monitoring the disease and treatment response, they should not delay the start of therapy. That's a wrap on today's session. I trust you now have a clearer picture of the crucial timing for initiating ART for a positive HIV-tested individual. Your engagement means the world to us, so hit that like button, subscribe for more insights, and spread the knowledge by sharing this video. Until next time, keep questioning, keep learning, and stay connected.